Hi, everyone. Today I will be presenting my research data on the disparities of oral health, primarily in the Hispanic agriculture workers in the United States. So, agricultural workers are known to be primarily made up of immigrants or migrant families. There's 2 to 3 million agriculture workers in the United States, while 32% are female, 68% are male. These agricultural workers have the same duties regardless of gender and regardless of age. Agriculture workers in the US are usually from 19 and older, but in some cases, children as young as 10 years old are part of the core workers in the fields across the country, picking fruits and vegetables that we see on our plates and tables. These workers put in long hours in a day and have long work weeks for very small pay, considering the harsh environment conditions and labor. They work outdoors in all weather conditions because they are essential workers who help provide food for our nation year round. Though they bring lots of crops in to feed not only the country, but the world, they are commonly not provided with fair pay or even health care. According to the National Center for Farm Worker Health, Inc., the socioeconomic status is primarily the lowest among the Hispanic agriculture community. With that being said, here's a bar chart that shows only about 14% of this population has sought or received any dental care, versus 86% of the population who has not received any dental care. The research suggests that limited access to dental care has highly impacted the Hispanic farm worker community in the United States with a 2.0 DMFT in comparison to the low income populations in other countries such as Puerto Rico, El Salvador, and Mexico. There aren't much of a difference, even though there are more dental care resources in general in the United States. More resources in the US does not mean more access due to the barriers this population faces. The data suggests this population is in high need of dental care access in order to reduce the DMFT. The research also suggests that agricultural workers represent some of the most socially and economically disadvantaged population. 33% of the agricultural worker families have had family incomes levels lower than the national poverty guidelines. Significant factors that contribute to the disadvantage of dental health include limited access to dental and medical health care, lack of health insurance, long term travels, poor nutrition or low food resources, linguistic barriers between patient and medical staff, lack of oral health knowledge. So, how can we help meet the needs of this population? We can help meet the needs by setting up workshops a couple times a year with volunteer dental professionals such as hygienists, dentists, and even student hygienists and dentists. Planning a group event increases the success probability as more professionals participating with different components such as planning, fundraisers, inventory, legal documents, and of course, the clinical duties. This will likely have a great outcome. These workshops would take place at a location near some of the farms so that workers are familiar with the area. These workshops should be focusing on preventative education in a way that it is easy to understand and suitable for the ages of the audience. To be able to educate a greater part of the community, we can create pre recorded lesson plans in English and in Spanish, one for adults and one for children, so that they feel comfortable with the information being presented. These videos should present general information about healthy periodontium versus signs and symptoms of unhealthy periodontium. They may not know the importance of preventative care. Therefore, toothbrushing and flossing techniques, types of toothbrushes, floss, and toothpaste, and other home care routines must be taught and reviewed. Nutrition can be a difficult subject to address since these communities are low income and food resources may be scarce. When educating about nutrition, we can briefly address the importance of drinking water, having vegetables, fruits, and avoiding too many unhealthy carbohydrates. These lessons can be very informative, so providing pamphlets for them to take home would be very helpful for them. There can also be a Q&A session after the lessons to address general dental questions. After the presentation, It would be beneficial if we have clinicians set up ready to provide oral screenings and, if possible, provide fluoride treatments. During those screenings, it's important to remind the patient the importance of screening and remind them about the lesson they just watched. Depending on the outcome, for future events and workshops, there could possibly be sealants placed for some of the attendees. In addition to these services, we can have resources of dental clinics that are free or low cost to guide the patient in the right direction if they decide they want to seek dental services. For the patients with insurances or looking into insurances, we can also have general resources on how to utilize the insurance and where they can apply for help. So, in conclusion, these community services and organizations can help aid the social injustice of Hispanic farm workers in the United States by reducing their lack of dental health knowledge and increasing their access to dental information, and, of course, hopefully improving their oral health. Thank you.